it means these mothers walked in and walked out with any out-of-pocket expenditure. Then we look at 254,000 of them delivered in the private facilities, 144,000 of them delivered it in the faith-based facilities, and 30,000 of them were referred to the level 6 facilities. Your Excellency, of the 17.5 billion that we've paid out, 9.7 billion has actually gone to county government facilities. If you look at the proportion that has gone to private sector, it is 4.6 billion, and to faith-based facilities, 2.6 billion. If you look at the last column, again to emphasize, this program, Linda Jamii, is way better than Linda Mama. 700,000 women walked in and walked out in 18 months with no out-of-pocket care expenditure. Thank you, Your Excellency. I'll now hand over to DHA.
Thank you, Excellency. My name is Anthony Lenayara, CEO, Dito Health Agency. Our work is we want to use digitization to ensure that we track each and every visit of each and every mother as they go through the process. This is the data for the last 1 year, and we have for each and every county. What we want to do is each and every governor will have a dashboard where they will track all the visits for a mother when it goes to clinic or when they are receiving service. If you look at this data for the last 1 year, just one area that need improvement, 1.4 million mothers have only had one ANC visit. Okay? Out of that, 880,853 at least have had 4 ANC visits. It means we dropped almost 42% of those mothers, and that can be one of the issues along that, that area. And we want, therefore, to give governors this dashboard to be able to track each and every of that place. Remember, the ANC visits are free under SHA. Primary health care, walk in, walk out. You should be able to go to clinic, and you should actually encourage all our mothers to at least do minimum 4. MOH guidelines is we should do 8. If you look at the analysis on details where we want to go now going forward, if you look at SHA, we actually check up to the name of the mother. So we want to go to the level that will tell the governors and any leader that we know the mother, the age, and the healthcare worker that treated them and why they had the death. And you can see, for SHA cases, for example, the last one was on May 16th. It might not be very clear. You have a name there. This is from Coast Referral Hospital in Mombasa County. We want to use this technology to give this information to the leadership to support us so that there is no mother that should lose life when they are giving birth. Thank you, Your Excellency. Yes. Your Excellency, in your Taifa Care dashboard, we just add this. Yes, we are just adding it in your Taifa Care dashboard. Yeah. Thank you.
Good afternoon, Your Excellency and Her Excellency. My name is Dr. Juliet Omoha. I'm the head of Newborn and Child Health at the Ministry of Health. Today, I'm going to take you through the newborn equipments that we need in our newborn units in the facilities. This first equipment is called a newborn resuscitator. This is the first point after delivery where we place the child. We are able to check the airway, to check the breathing, assess if there are any complications. If there is any emergency, this is the place we note and we act immediately. This equipment is very important because we know our newborns die because of low temperature. This machine is able to gauge the temperature of the child and adjust to the child's normal temperature. It is also the equipment that you're able to adjust oxygen concentration in case the child is on oxygen, and also be able to fix a suction machine if there's any excretions from the child's mouth. Your Excellency, this next machine is called an oxygen concentrator. We know at times our children are born and they cannot breathe, and there is need for oxygen for them. This is an important device because it's able to deliver oxygen. In children, oxygen is a drug. So you're able to regulate the amount of oxygen needed for each child with this important equipment. Your Excellency, the next equipment is called a continuous positive air pressure machine. This is also used to deliver oxygen to the child. We know we have our babies in the country who are born too soon and their lungs are premature, and this equipment is able to continuously provide oxygen to our children until their lungs are able to breathe on their own. Your Excellency, this machine with the blue light is called a phototherapy machine. It is used to manage newborns with neonatal jaundice. Neonatal jaundice is yellowing of the child's skin and is produced by something called bilirubin. It's very dangerous. If it goes to the baby's brain, they can actually get brain damage and die. In our facilities, we have this machine called Bilidix. Bilidix is able to assess the exact level of bilirubin when it comes to the child's body. When we realize the range is higher than usual, we bring the baby and place the baby in the resuscitator, covering only the eye, full exposure, and this phototherapy light is able to break down the bilirubin in the child's body for it not to assess the brain, so it protects the brain and the child is able to excrete the excess bilirubin for them to be able to survive. Your Excellency, this array of machines in the newborn unit are very essential for our survival of our newborn. We are aiming not only for survival of the newborn, but thriving and for every child in Kenya to live in their best potential. Thank you for your time, Your Excellency. Yes, Your Excellency.
Your Excellency, will now progress to the flag-off for the equipment. The flag-off of the equipment, which is going to 20 counties, and His Excellency will be flagging them off. The flag-off of the equipment, as mentioned, it's going to 20 different counties. This is the medical maternal equipment. Your Excellency, in 3, 2, 1. Tumpigie makofi tafadhali. And the counties that are going to benefit immediately, we have Migori, we have Garissa, Mombasa, Kisii, Kitui, Nairobi, Machakos, Nakuru, West Pokot, Tana River, Wajir, Trans Nzoia, Bungoma, Homa Bay, Kwale, Siaya, Kilifi, Kakamega, Kajiado, Uasin Gishu, Meru, Samburu, Elgeyo Marakwet, Mandera, and Turkana. Those are the 20 counties that are going to immediately benefit from the equipment. And as we see, it is every woman, every newborn, everywhere, ensuring that mothers and children do not suffer like they have done before. No mother should die and no child should die unnecessarily as they bring a newborn. So that brings us to the end of this side of the section. We'll now progress to the pavilion, where we have the main event, or where we have other guests waiting for the plenary session of this launch of medical equipment.
Naomba tafadhali sote tusimame tuanze kuimba. Tupige makofi kidogo, makofi makofi. Makofi, makofi. Akina mama wananchi wote, viongozi wote, tushikane mikono tuitenge Kenya. Tumkaribishe Mheshimiwa Rais kwa makofi. Akiandamana na mama taifa. Wanaona tutoke kwa mitandao. Karibu Mheshimiwa Rais. Akina mama tufunge maleso. Karibu mama taifa. Tusiwatukane viongozi kwa mitandao. Karibu. Let's take a step ya kuleta mabadiliko. Wale wanatoka ghetto wote na wale wata. Wale wanatoka village wote na wale wata. Uptown, downtown, downtown. Thank you, studio. We may have our seats kindly. Your Excellency, Dr. William Samoei Ruto, the President of the Republic of Kenya and Commander-in-Chief of the Defense Forces, Your Excellency, Mama Rachel Ruto, the First Lady of the Republic of Kenya, Cabinet Secretaries present, led by Honorable Aden Duale, Cabinet Secretary, Ministry of Health, Principal Secretaries present, led by Dr. Omar Oluga, Principal Secretary, State Department for Medical Services, Honorable Ahmed Abdullahi, Chairperson, Council of Governors, Governors present, Dr. Neema Kimambo, Acting World Health Organization Representative to Kenya, Members of Parliament present, National and County leaders present, Heads of institutions, development partners, our mothers, distinguished guests, ladies and gentlemen. Your Excellency, we are here because we believe that no woman should die while giving life and that every newborn deserves the right not only to survive, but to thrive. This belief is the driving force behind every woman, every newborn, everywhere acceleration plan. And now, Your Excellency, with your permission, allow me to invite on stage PS Dr. Oluga to guide on the program. Tumkaribishe kwa makofi Bwana PS.
Your Excellency, the President of the Republic of Kenya, Dr. William Samoei Ruto, Her Excellency, First Lady of the Republic of Kenya, Her Excellency Rachel Ruto, Cabinet Secretaries present, Governors present, and following the protocol already established. Your Excellency, we are here today for the launch of Every Woman, Every Newborn, Every Acceleration Plan through a rapid result that intends to look at a number of intervention areas. Key among them is standardizing emergency medical obstetric care across our facilities. Number 2 is improving the quality of care that is provided. And number 3 is to accelerate action across all partners so that we can get to the target of 2030 to improve and meet the SDG indicator for 70 out of 100,000 deliveries, and also for newborns to reduce our newborn deaths from 21 out of 1,000 deaths to 12 out of 1,000 deaths. Your Excellency, we want to thank you for your leadership, your commitment, and your support in this plan. And Your Excellency, my role here is just to tell you who is in the room, because this is a whole of society approach. Your Excellency, as you have already noted, we have with us the national government represented by our cabinet secretaries and also the principal secretaries. Your Excellency, we have the Council of Governors represented by the chair of the Council of Governors, the deputy, and also governors from particular counties. We have members of parliament, Your Excellency, particularly members of parliament from the Senate Health Committee and also the Committee of Health in the National Assembly. Your Excellency, we have women leaders in both houses of parliament and also across government. Your Excellency, we have the agencies that are responsible, the Social Health Authority, the Digital Health Agency, the regulators. Your Excellency, we also have health workers who are presented here. The professional associations are here, 20 professional associations. We have the unions. Your Excellency, we have our development partners, both philanthropic foundations and also UN agencies led by WHO and UNICEF. Your Excellency, we have implementing organizations, that is the non-state institutions that are intervening in the communities. We have academic institutions, Your Excellency. We have medical training institutions here with us, Your Excellency. We have the religious leaders, Your Excellency. We have chiefs and local administration. And Your Excellency, we have your favorite group, the community health promoters, who are our true champions, Your Excellency, as you can see. Your Excellency, we also have a number of community-based organizations that are led by women leaders. We have the youths and adolescents. Your Excellency, we have the men's group. And Your Excellency, we also have members of the community. Your Excellency, at this point, I would like to invite 2 representatives. One is the male champion to just have few remarks, and also a female champion. So if we have Lawrence, and also if we have Lavender, please. Your Excellency, let me invite the State Functions Secretary, Mr. Gitonga, back to the stage.
I have been instructed by the PS that we have not prayed, so let me request that we stand up and pray. As for the national anthem, please, we can have a Muslim and one of the clergy to come and just guide us in the prayer before we progress. Karibu.
Let's pray. Bismillahir Rahmanir Rahim. Alhamdulillah wa salatu wa salam ala Rasulillah. All praise is due to Allah, the giver of life, the protector of mothers and children. Oh Allah, we thank you for this initiative, every woman, every newborn, everywhere, aimed at protecting lives and ending preventable deaths among mothers and children. Allahumma barik this noble effort with sincerity, wisdom and success. Grant strength, knowledge and compassion to doctors, nurses, caregivers, leaders, and all those working to safeguard mothers and newborns. Ya Hafiz, protect every expectant mother during pregnancy and childbirth. Grant health and safety to every newborn and ease the suffering of families facing hardship and loss. Ya Allah, make this initiative a means of mercy, healing, justice, and hope for communities everywhere. Unite us in service to humanity and guide us to uphold the dignity and sanctity of every life. Ya Mujib, accept from us, for indeed you are all hearing and all knowing. Send peace and blessings upon your beloved prophet, and we pray, Amen.
In the name of God the Father, the Son, and the Holy Spirit. God our Father, who has given us this day to launch the UNA initiative, we thank you for the gift of life. We also thank you for the effort of those who have worked tirelessly in ensuring that this day and this launch is successful. We pray that all the time and resources spent in this initiative will bear much fruits in our nation in reducing maternal and newborn deaths in our nation. We thank you today as we gather here to launch this initiative, which is going to help us and remind us of our duty as a nation to promote the lives of our dear mothers and those being born. We pray that no life will be lost through childbirth. May we see more lives coming from our health facilities. May you cause this initiative to be a constant reminder of our duty to be agents of life as we ensure healthy lives and promote well-being for all at all ages. We thank you for your servant, our President, His Excellency Dr. Ruto, together with the First Lady, who have clearly demonstrated their commitment and that of our nation in promoting the Okoa Mama, Okoa Mtoto call to action. As you have commanded us to let children come to you, we pray as a nation you will continue to prioritize and address the needs of our children and nurture them with love, patience, and care, and also those that are bringing life. Make our children to grow in your knowledge, wisdom, and favor. We thank you and pray for the Ministry of Health, together with all the departments therein, the Council of Governors, collaborative partners, religious leaders, and all stakeholders. Bless our land, our nation, as we strive to safeguard and promote maternal and newborn health. Through Jesus Christ our Lord, we pray. Amen.
We may now take our seats. Your Excellency, with your permission, we'll then progress to the two leaders. We have Ms. Lavenda Achieng, who is a community member, and Mr. Lawrence Omondi, who's a community member, to also just come and speak briefly on this initiative. Why don't we give them a clap as they come together? Karibuni. And we'll start with the lady. Ladies first.
Mheshimiwa Rais, Mheshimiwa Rais, kwa majina ni Lavenda ama Mama Dwen, mkaaji wa Kayole Matopeni. Nafanya kazi ya kufulia watu manguo. Mheshimiwa Rais, nilikuwa na mimba. Nikaenda pale hospitalini Njiru. Siku moja nikiwa kwenye kazi zangu, nilianza kusikia maumivu kwenye tumbo. Mheshimiwa Rais, nilirudi pale hospitalini kujifungua. Niliweza kujifungua vizuri. Mheshimiwa Rais, niliweza kupoteza mtoto. Nilimwaga damu nyingi sana. Nilimwaga damu nyingi sana. Mheshimiwa Rais, kwa wamama wenzangu wenye wako hapa, naweza waambia ya kwamba unapokuwa katika hiyo hali, usifanye kazi ngumu sana. Usifanye kazi ngumu sana. Na pia unapokuwa katika hiyo hali, tafadhali tuende kliniki mapema. Ndio tuweze kusaidiwa. Asanteni sana.
Mheshimiwa Rais, my name is Lawrence Omondi, and I'm speaking on behalf of men in the community. Mr. President, amongst us are angels, our mothers. And amongst us is my angel, my dear wife, seated back there. Mr. President, my wife has been pregnant 3 times. But my wife has lost 2 of our newborns. Mr. President, from the death of our son, we had twins in her last pregnancies. We started something called Machozi ya Mwisho Initiative, because the pain we went through as a family, I cannot describe it. And the pain many Kenyans go through when they lose their newborns, the pain many men go through when they lose their partners while giving birth, that machozi must be ya mwisho. Mr. President, I know, we know, and all Kenyans know that you support Arsenal, right? Mr. President, in the community, we have met many men who have lost their wives while giving birth, and 2 of them are here, Victor and Brian. Mr. President, we have met men who can tell you the whole lineup of Arsenal and Chelsea, but cannot tell you a single danger sign in pregnancy. Mr. President, we have not met men who know that on Saturday this week, Arsenal will be traveling to Baku to play Champions League final, right? But they cannot tell you when they're supposed to travel to clinic to take their partners. But I have a question. Do you think we should blame those men? No. We should never blame them. Because the rate of awareness among men when it comes to pregnancy and maternal care is very low. Mr. President, as I finish, I only have two requests. Request number one, that you'll support us. You'll support organizations like mine, an organization seated here, that will reach every man in every community with knowledge, with empowerment, that they will know maternal care is a shared responsibility. Mr. President, this is my final request. As men, we have never had a patron who is telling us the reason why you should go to clinic. Mr. President, I request you to be our patron. Mr. President, like the pain of losing my two newborns, today let's say every woman everywhere, no mother should ever die while giving birth, and no family should ever go the pain that my wife and I went through when we lost our son. This one must stop. God bless you.
Your Excellency, after hearing the moving testimonies from our community members, at this point I would like to invite you to watch a short video that highlights the progress that the country has made in maternal and newborn care. Karibu.
Beginning starts with a moment, but a safe birth is never just one moment. It is the result of many moments working together. Every 2 minutes, a mother dies from pregnancy or childbirth complications globally. Sub-Saharan Africa, including Kenya, accounts for nearly 70% of these deaths. The first 28 days of life are the most critical for a child. Approximately 92 newborns die every day in Kenya. Most risks for mothers and babies are preventable with timely, quality care. Saving mothers and newborns requires more than skilled hands. It requires systems that work. Skilled health workers, prepared facilities, essential medicines, strong referral systems, reliable data, government leadership, national commitment, quality care priority.
Every mother is so critical to the well-being of their family and our economy. And that's why, under the leadership of President Ruto, we are giving it high prominence that if we stop the death of a mother and a newborn, that translates into more human capital and our social cohesion in our country. And we have implemented the RRI accelerated program in the last 3 months, and we want to make sure that we use that for the MDS-RC to gauge what is happening at our healthcare delivery system. And this RRI is the tool that we use both for the short term and for the long term. It gives us a very impactful assessment of the whole ecosystem. Every woman, every newborn, everywhere is anchored in our RRI and is integrated also into our RAMCA and investment care, cascaded down to our 47 counties. That is the roadmap Kenya has set itself for, to make sure that no mother, no child dies, but every mother and every child lives and thrives.
Across the world, countries are accelerating action. Ewene is a global initiative spearheaded by WHO, UNICEF, and UNFPA. In Kenya, it is led by the government through a multi-partner platform. Every woman, every newborn, everywhere.
I commit to make sure that the right policies are in place, and at our country level, led by our governors, to make sure that their facilities are on the spot and they check that all that is required from commodities to technologies to staffing are provided for. So we are well coordinated in that plan. Kenya is ready. We are committed. We have made a deliberate effort, both in terms of providing resources, human capital, working with partners and donors and NGOs to make sure that Kenya becomes a leader in reducing both maternal and newborn child. We want to reach the targets that WHO has set to make sure that no mother, no child dies, but every mother and every child lives and thrives.
Change is possible when governments, partners, health workers, and communities act together. Kenya is accelerating action for mothers and newborns because every beginning deserves a chance.
Kenya remains firmly committed to protecting the lives and future of women, children, through sustained system-wide health reform and accountable delivery. Financing, however, must be matched by clinical readiness. Under our Maternal and Newborn Health Rapid Results Initiative, we are concentrating resources in 26 high-burden counties and delivering bundled medical equipment directly to last-mile facilities to strengthen emergency, obstetrics, and newborn care.
Your Excellency, with your kind permission, at this point I would like to return the program to PS Dr. Oluga to continue. Tumkaribishe tena kwa makofi, Bwana PS.
Your Excellency, without further ado, let me invite on behalf of development partners, Dr. Neema from WHO, Dr. Neema Kimambo, please, for your remarks.
Your Excellency, President of the Republic of Kenya, Honorable Dr. William Ruto, Excellency, First Lady, Madam Rachel Ruto, Honorable Cabinet Secretary Health, Aden Duale, and other Cabinet Secretaries here present, Principal Secretaries, Governors, Parliamentarians, Development Partners. May I ride on existing protocols and say, distinguished guests, ladies and gentlemen, good afternoon, hamjambo. It's an honor to say a few words on behalf of development partners at this landmark event. Your Excellency, convening this launch at the State House, you have sent an unambiguous signal that safe pregnancy and delivery by mothers and survival, well-being, and development of newborns is a national priority at the highest level. On behalf of all partners present here today, we welcome and applaud the political commitment of the Republic of Kenya. The urgency of this moment cannot be overstated. Africa accounts for roughly 70% of all global maternal deaths and half of newborn deaths, not because solutions don't exist, but because the systems to deliver them have not been built, sustained, or held to account at the pace that is required. Today, Kenya is choosing a different path. Kenya has made significant progress over the decades. Skilled birth attendance has increased to 89%, and 98% of all pregnant women have access to at least one antenatal care visit. The Ewene Acceleration Plan of 2026 to 2028 is one of the most comprehensive evidence-based national blueprints on this agenda. Just 2 months ago, Kenya hosted the International Maternal Newborn Health Conference 2026, sharing its innovations and its lessons with the world. This is a country that is not merely talking about saving lives, but is committed to building the architecture to do it. Yet truth demands that we speak plainly. Approximately 16 mothers die every day, and 90 newborns die every day. These are not statistics. These are names. These are absences at dinner tables, at school gates, and an economic loss to the country. The Ewene Acceleration Plan and Maternal Newborn Health Rapid Results Initiative addresses exactly this, the gap between access and outcomes, between a woman reaching a facility and receiving quality care that saves life, her life and that of her baby. This initiative is specific, time-bound, and measurable. And on behalf of WHO, UNICEF, UNFPA, and the broader community of development partners and civil society, our presence here today demonstrates our commitment to align our technical expertise, our resources, and our advocacy behind this initiative. We stand ready to support the Ministry of Health and county governments across the 5 pillars of the Rapid Results Initiative: governance, health workforce, data, quality of care, equipment, and commodities such as essential medicines and supplies, as well as family planning commodities. Your Excellency, you have established a leadership and coordination structure for the MNH-RRI initiative with a steering committee that is chaired by the Cabinet Secretary for Health, driven by principal secretaries in the ministry, and behind the technical leadership of the Director General, cascading this down to every governor in the country. That structure is the difference between a plan on paper and results in a delivery ward. We will hold ourselves accountable within the structure. We will hold each other accountable, because the women and newborns of Kenya deserve nothing less. Together, let us make preventable maternal and newborn deaths an issue of the past in Kenya. Let Kenya's efforts light the way for Africa, and let this moment at the State House be remembered, not for the words spoken, but for the lives of mothers and babies saved. Asanteni sana.
Thank you, WHO, on behalf of all our development and implementing partners. Your Excellency, now we will hear from one woman leader and also one county that has a better story. And on that note, Your Excellency, allow me to invite Her Excellency Governor Anne Waiguru.
Your Excellency, President of the Republic of Kenya, Your Excellency, Dr. William Samoei Ruto, Your Excellency, the First Lady of the Republic of Kenya, Her Excellency Rachel Ruto, Cabinet Secretary for Health, my brother Aidan Duale, Principal Secretary for Health, my colleague governors, led by our chair of the Council of Governors, the members of Parliament who are present, distinguished guests, ladies and gentlemen, good afternoon. Good afternoon again. It is a profound honor for me to stand here on behalf of the people of Kirinyaga County and to have been recognized as a county that has performed well in this area of maternal health. The guiding policy of our health sector has been clear: to strengthen curative and rehabilitative services, expand comprehensive healthcare in line with the Kenya Essential Package for Health, promote preventive and promotive care, and enhance administrative coordination for effective service delivery. Your Excellency, for the last 9 years, my administration has deliberately invested in healthcare infrastructure, bringing specialized services closer to our people, especially mothers and newborns. Each financial year, we have consistently accounted for 47% of our county budget goes to health, ensuring both facility improvement and human resource development. Your Excellency, as you're aware, we were honored to have you because we completed and operationalized the Kerowe Level 5 Hospital, which we were very pleased that you officially opened for us. We equipped a modern maternity wing in that hospital with 80 beds and fully functional newborn unit with a capacity of 60. In addition, we have 4 Level 4 hospitals that we are nearing completion, 2 of which we expect to be done in the next 2 months or so. And with this, we expect to add another 90 maternity beds and 50 newborn units in our Level 4 facilities. In 2017, Kirinyaga had about 50 health facilities. Today, we have grown to 85 health care facilities. On provision of drugs and supplies, we have maintained a steady supply of essential drugs. You will be told by KEMSA that we're one of those counties that never have any debts, outstanding debts with KEMSA. We allocate approximately 600 million shillings a year for drugs alone to ensure all our facilities are running throughout the year. On human resource, Your Excellency, parallel to infrastructure growth, we have strengthened our health care workforce. Recruitment has continued on a need basis. We have increased our technical capacity of medical officers, cutting across the entire medical field. I will not list them because there are quite a number. We have also prioritized staff motivation and recently promoted our consultants and are planning to promote the remaining contract staff that we have and transition them to permanent and pensionable terms coming in this financial year. On community health services, Your Excellency, we know we are partnering with you, and like all other counties, we have engaged 854 community health care promoters, and we have over 115 community health units. In Kirinyaga, Your Excellency, we have our health information system, which connects all our facilities, are integrated and connected using the healthcare information and management system. We're therefore able to share data across all our facilities, monitor all the patients that are coming in, disease prevalence, including the use of facilities. So the impact on these health indicators, Your Excellency, you may be wondering why we're standing here. Antenatal coverage in Kirinyaga has improved from 45% to 63%, which is above 61.3 national standard, and we are working towards the global 87%. Your Excellency, on maternal mortality, we have reduced maternal mortality in Kirinyaga in the years that I've been there from 88 to 55 deaths per 100,000 live births, which is lower than the national average of 355. Kirinyaga is at 88, and we are working with a target of 55 by the end of next financial year. On the live births, Your Excellency, we are even way better than the set SDG target. We are at 20, neonatal mortality has declined from 26 to 10 deaths per 1,000 in Kirinyaga. And when I started, we were 26, now we are at 10, and we want to take it to below 0. The national standard is currently at 21, and the standard that is recommended is 17.2. So you can see Kirinyaga is way below at 10 deaths. On skilled birth attendance, we have risen from 87% to 92% of all the children born in Kirinyaga are assisted by a skilled birth attendants. Immunization coverage, we have increased from 81% to 91%, way above the national average of 80% and the global standard that is recommended of 85%. So we are even above the recommended international standard on immunization. On mother-to-child HIV transmission, we have reduced from 13% to 6.5%, less than the 9.3 national standard average. And the same applies for TB treatment, and our first antenatal care coverage, Your Excellency, in Kirinyaga, first antenatal care coverage has risen from 93 to now 98%. So we are very grateful. On the issue of the social health insurance program, Your Excellency, as you're aware, Kirinyaga is currently at 72% of the Kirinyaga population is registered, ranking as 4th nationally, and this we have achieved without any assistance so far, and I have been pleading with the minister, if they came and helped us with our indigents, we'll provide the resources for it. We can register over 80 to 85 or 90% of our staff. Your Excellency, as I conclude, we remain steadfast in investing in infrastructure and equipping our facilities in Kirinyaga. And many people may wonder, but my staff, if you talk to my staff and my healthcare team, they know the emphasis I put specifically on maternal health. Myself, Your Excellency, I was born a premature baby. I was born at 7 months, and I was in an incubator, I'm told, for about almost 2 months in those days, and I barely survived. One of my children, who's my third born, I almost lost my life and his when I was expecting him, because it was an emergency situation where he was born also at just over 7 months. And if there is anything that I take with passion, even in Kirinyaga, and anyone who works for me knows, is the issues of maternal health. And I would want to encourage every mother, even if you're not a mother, every person who has a role to play in public service, whether it is in financial, providing the resources, policy, we urge all our colleagues to put enough investment. There can be no better investment than an investment to a mother, and especially when a mother is bringing life into the world. So, Your Excellency, we are thankful. We support this program, every woman, every newborn, everywhere, and we will work hand in hand with the national government to ensure that it's a success. Asanteni sana.
Thank you so much, and good work there in Kirinyaga. Your Excellency, on behalf of elected members of Parliament, both at the Senate and the National Assembly, and specifically on behalf of the Kenya Women Parliamentary Association, allow me, Your Excellency, to invite Honorable Leah Soipato to make very, very few remarks before we go to the Council of Governors, Your Excellency.
Thank you so much, Your Excellency, the President of the Republic of Kenya, Your Excellency Rachel Ruto, the First Lady of the Republic of Kenya. CS is present, led by my very own brother, Honorable Adan Duale, and all members of Parliament present, and everybody present. I want to take this opportunity to greet you all. Good afternoon. I don't have a written speech because the issues of women and what women go through every day are actually written in our hearts. Your Excellency, today marks a very beautiful day for the women and the children of Kenya. We are here as members of Parliament to fully support this program because the two community members that spoke here spoke from their hearts, and every household in the Republic of Kenya has a story to tell on delivery of babies, losing babies, and what happens during delivery. Your Excellency, when they were giving their testimonies, I know that every woman in this room and every person in this room have gone through the trauma of either losing a baby, almost losing a baby, or almost losing a mother or both during delivery. Your Excellency, as I stand here today, I also stand as one person that almost lost a baby during delivery. And so when I see this program today, every woman, every newborn, and especially everywhere, I know that the women of Kenya has had another win today through your administration. Your Excellency, I'm standing as an elected leader on behalf of elected leaders, and I also stand as a pastoralist woman. I know that back in the county that I come from, I know we have lost a lot of babies during delivery. I know we have lost women during delivery. Your Excellency, this program today is a win because we will sensitize our women, because one of the things that actually makes us lose baby during delivery is negligence, Your Excellency. When you walk into a hospital, you have pain, you're just almost about to deliver, but most of the time, there's a lot of negligence in our clinics. And I'm so happy today that through this program, the issues of negligence will be a thing of the past for the Kenyan woman, for the Kenyan babies, as we go forward, Your Excellency. Your Excellency, I can say that most women also don't access healthcare in the right time. One of the things that makes women not access healthcare in the right time. Your Excellency, I had my firstborn baby at 20 years, and I had my baby at home because the women who are taking care of me could not know the right time to take me to the hospital. They kept saying, it is not now, let's wait a little bit. And fortunately, I got my baby, but my baby was alive and I'm alive, and I was rushed to the hospital with a baby. Your Excellency, I had my second baby at the hospital, but the experience I had at the hospital, I kept telling myself, I wish I have had this baby at home. Because, Your Excellency, the moment I arrived there, the nurse that was attending was actually having lunch. And she actually said, you can wait in that room as I finish so I can come and attend to you. Your Excellency, I am actually giving a true story. And I felt at that point that I wish I was at home where those women can look after me, where those women can encourage me and tell me that this can happen and can happen well. Your Excellency, by the time the nurse came to attend to me, I gave birth in a hospital chair, and the nurse was there for more than 40 or 1 hour. Your Excellency, I hope that through this program, there's no other woman that will give a baby on the chair or will give birth in a very awkward position, because this program will also sensitize our caregivers to take care of the mothers during this time. I know the mothers know what I'm talking about, because giving birth is actually between life and death. You don't know whether you will survive. You don't know where your baby will survive. You're just there trusting God. And the worst thing that can happen to you is to find a rude or a cruel nurse to attend to you. I want to speak to practitioners today. Women don't come to the hospital to lose lives. Women don't come to the hospital to lose a baby. They come to the hospital with the hope that they will go back to their families with a bundle of joy that they have taken care of for 9 months in their stomachs. And I want to urge you today, as we move forward this program, let us also make sure that we take care of our babies. I am sorry for the women that have lost their babies. I know it is painful. Every woman, when they get pregnant, they take care of themselves. They take care of the food that they eat. And especially us from the rural community. Your Excellency, sisi tunapojaliwa na mtoto, unakatazwa kula chakula, saa zingine unakatazwa kunywa maji, na mara mingi unakatazwa kufanya kazi mbalimbali, na wewe pia unataka kuangalia mtoto ambaye yuko tumboni. Na ingekuwa muhimu sana ukifika wakati wa kujifungua, pia wale wanaokusaidia wajue kwamba umebeba uhai na umekuja hapa ili urudishe uhai nyumbani mahali umetoka. I hope that through this program today, every woman going to the hospital will go back home with a bundle of joy that they've so looked forward to having in their past 9 months when they were carrying the pregnancy. With those few remarks, Your Excellency, I want to recognize the members of Parliament present. I think I will just request them to come forward so they can be recognized. They are here to support this program. They can stand, yes, they can just stand. All the members of Parliament, please clap for them. These are the champions. These women will help support this program from the
Honorable Leah Soipato for those heavy words of encouragement to our practitioners. Your Excellency, at this point, I would like to invite the Chair of the Council of Governors Health Committee, who will recognize all the governors present, and in turn invite the Chair of the Council of Governors to make remarks.
Asante sana. Your Excellency, the President, Your Excellency, the First Lady, the CSs who are here, I know we had more than one CS who was with us, my colleague governors, PSs, development partners, members of parliament, wazazi wenzangu, CHPs, hamjambo. Your Excellency, kabla sijaanza kuongea kidogo, mimi utaniruhusu nichanganye. Nitachanganya kwa wale wa huku waelewe, na hawa wa huku na huku pia waelewe, kwa roho safi tu. Your Excellency, kwanza tutoe shukrani. The testimonies that were given by the two champions was truly intriguing. But when I was seated there, my fellow governors told me you have to convey this, and they said that Lawrence must have something against Arsenal, because out of all examples, the only example he gave was that why are men more on Arsenal than anything else, and I think it has come to a realization his team must have lost. We wish him luck in the next. Your Excellency, first and foremost, allow me to start by acknowledging that this launch marks an important milestone of a journey towards increasing maternal and child survival in Kenya. I believe that the investments that the country has made in maternal and newborn health, coupled with the confidence that communities have currently in our health systems, can significantly aid a shift in the performance of key indicators in our healthcare. The responsibility of saving the lives of mothers heavily depends on how we, as leaders, set the pace, prioritize and support both levels of government, working collaboratively. I think I hear that, sorry, Your Excellency. The responsibility of saving the lives of mothers heavily depends on how we, as leaders, set the pace, prioritize, and support both levels of government working collaboratively to steer the health sector. As county governments, health service delivery remains a priority and is demonstrated by counties allocating an average of 30% of their budgets, and in many cases, Your Excellency, more than that 30% to the health sector, reflecting our commitment to improving health outcomes, particularly in maternal and newborn health. We continue to invest in strengthening maternal health through expansion of skilled birth attendants, recruitment of health workers, strengthening referral systems, increasing access to emergency obstetric and newborn care, improving commodity availability, and investing in community health systems. In strengthening community health systems, we recognize that maternal survival begins long before women reaches health facilities. Our able community health promoters continue to play a critical role in early identification of pregnancies, referral, follow-up, and promoting uptake of antenatal and postnatal care. It might not harm to state a fact that on the advent of having a law on community health promoters, it is this government that actually started paying a stipend to these community health promoters. Ni lazima tuambiane tu ile ukweli iko. It is the partnership between the national and county government. This is the beauty of working together. The partnership that we have, currently there's about 100,000 CHPs who are receiving a stipend from the national government. A small variance of about 7,000, we are paying about 107. I know that there are plans for this financial year for the same to be a conditional grant, so that when we are paying salaries, we pay them whatever is due from national and county together. They don't have to wait for 2 payrolls. Na kwa hiyo CHPs munasemaje? Sio mimi nimesema, Your Excellency, ni wao. And it is equally important to state it, Your Excellency, it is equally important to state it, that the community health promoters actually are the face of this country. And when I say the face of this country, I say this with a lot of bright hope that despite this ethnic bigotry that is going on in this country, just those that are here, they are people from all over Kenya. You will see them right here, and they're the ones who are handling. And I congratulate this partnership, Your Excellency, for taking this initiative. The Inter-County MPDSR initiative has been a cornerstone in our counties. We started this journey, Your Excellency, about 8 months ago, the Inter-County MPDSR, and this is something exactly similar to what Ewene is doing, and we hope that this will not be something that we're going to be duplicating, but we are hoping that we can be able to complement each other and we don't have to work in silos between county and national government. And this is all in efforts to address preventable deaths amongst our most vulnerable population, mothers and newborns. Notable success has been realized through activation of MPDSR committees by all the 47 county governments, and as evidenced by our facilities such as Kiambu Level 5 Hospital, which reported 0 maternal deaths within a period of 7 months, which also included several other public health facilities in this country. I cannot be able to mention them all, but off the cuff, Muranga, Homa Bay, and many other counties have been able to come up with a huge success story on the same. And through the Inter-County MPDSR initiative, counties have prioritized moving beyond counting deaths to understanding why mothers and newborns die, and taking corrective action to prevent recurrence. This accountability approach is central in improving quality of care and preventing avoidable deaths. The Council of Governors continues to provide leadership in coordinating county efforts through advocacy, policy engagement, intergovernmental dialogue, and strengthening accountability mechanisms for maternal and newborn health. Further, we have also invested in digital transformation and data-driven accountability, including development of the inter-county MPDSR dashboard and GIS-enabled platforms. Your Excellency, again, once again, we hope that the dashboard that was presented to yourself, to ourselves, by the team from Digital Health Agency, we can be able to work on the dashboard that we already have as a county government. We can be able to work together, integrate whatever it is that we do, the governor's dashboard as well, so that we do not have to work and duplicate on matters, but we can actually work together to make this more successful. And these dashboards support real-time visualization of maternal and perinatal indicators, hotspot mapping, tracking implementation of recommendations, and informing targeted interventions. These innovations strengthen decision-making and move us closer to predictive, responsive health systems. Despite progress, and this is the reason why we welcome the initiative of EWENE, and why we congratulate national government partners and our partnership. Because despite this progress, we acknowledge that maternal mortality can be lower, with significant disparities across counties. This has further underscored the need for joint efforts towards accountability and action, and that is why, as governments, for the next 6 months, counties will be accelerating maternal and newborn health interventions. Your Excellency, it requires our collective effort, bringing together leadership, innovation, technology, evidence, and accountability to ensure every mother receives timely, quality, and respectful care. And this is one of the things that need to be congratulated. And I'm seeing a lot of media houses, I hope this is what they will actually be publishing. That are one of the headlines, that actually 20 counties today are receiving equipment that is going to be able to assist a pregnant mother who otherwise would have been in a different situation, with an extra 27 counties to follow suit as well. We reaffirm our commitment, Your Excellency, to strengthening maternal and newborn health systems and ensuring that investments translate into measurable outcomes for women and families. The Council of Governors remains fully committed to working with each of the partners in this very auditorium by directing support where it really matters and making preventable maternal or newborn mortality abnormal. And Your Excellency, the Council of Governors did send a team to the counties of Tana River. We sent a team to the counties of Kilifi so that we can have some peer engagement together on these matters. Waziri informs me that we are running out of time, but Your Excellency, I want to state some facts. And I say this as the governor. Previously, all public health facilities would be dependent on donor funding. We need to state it as facts, because if we don't state it as the way it is, others will state it the way it isn't. Previously, all public health facilities, right now, the funding from donor agencies has greatly reduced. Without the initiative of saying that let us have SHA for our level 2s and level 3s, for people to be able to get access, to be there, today, many health facilities would have been a problem. Today, health facilities would have had to charge for these facilities. Your Excellency, despite the PS being here, I will also need to state facts, because it is the way it is. I've had this argument about Linda Mama and SHA. I've not been a governor before. This is my first time as being the governor of Mombasa. But I can tell through the records that were there. Previously, what was being paid by NHIF, which was what was Linda Mama, was 2,500 shillings for a normal delivery. Today, SHA is paying a normal delivery between 10 to 12,000 shillings. You know, I'm only stating facts. The cesarean, NHIF was paying anywhere between around 5 to about 17,000. Today, SHA is paying 30,000 to 32,600 shillings for the same cesarean. Are there challenges? Of course, there are challenges. That's why we're leaders. That's why we are here. That is why we have to be able to combat these challenges together. But the fact remains, it is this administration and it is this group of governors that have taken it head on to ensure that we have free universal health, something that started prior to many presidents trying to ensure that we have this free health care for our people. A journey has started. Naysayers are going to be there. Let those naysayers not be the ones who are going to be turning us down. And lastly, Your Excellency, I also envisage tomorrow's headline will read that State House hosts the youngest babies, and I'm wondering what they're fed here because they're very, very quiet. I was actually surprised. For those who don't know, we have a number of mothers and babies. Thank you very much, Your Excellency, and asanteni sana. And with that, with those very many words, allow me to invite our able chair, the chair of the Council of Governors, who's also the governor of Wajir, Governor Jir, to be able to give his remarks.
Your Excellency, the President of the Republic of Kenya, Dr. William Samoei Ruto, Your Excellency, First Lady Mama Rachel Ruto, CS, Excellency Governors, distinguished ladies and gentlemen. Your Excellency, I know we're really stretched for time, but I just want to break protocol and invite the governor of Nairobi, because these are his people, so that he can greet them at least.
Your Excellency, the President of the Republic of Kenya, Madam First Lady, viongozi wote, allow me to recognize the protocol established. Many times, you know, the challenge of being in State House is people forget it's in Nairobi. But allow me to welcome everyone to Nairobi. Karibuni sana. Marafiki zangu CHPs, mpo? Your Excellency, hawa ni marafiki zangu sana wa dhati na wajua kwa majina. Ule alikuwa anafanya hivi ni Sean Mokorino huyu wako. Na ni watu wazuri sana na wanakupenda zaidi. Na pia wazazi ambao tumeona na watoto, karibuni sana. Your Excellency, I will not say much because of time. But really, I know today, and it's, you know, it's lingering in my heart, while we are celebrating maternal health care in our children, we have lost a number of children in Nakuru County. And I know you will lead us in a moment of silence, just to recognize the parents and the siblings who are mourning at that very tragic and heinous act that has happened, Your Excellency. Your Excellency, when the lady was speaking, you were very emotional because you felt her pain. So I want to thank you for what you've done in this healthcare space. 20 days after I became governor, na watakuambia, I was at Mama Lucy Hospital. And when I was there, I saw, you know, a sad situation. Women sharing beds, you know, the state of the hospital was bad. And so what I did, I set up a health reforms task force in Nairobi. That task force was led by Professor Olive Mugenda, we had Dr. Githinji Gitai, we had Dr. Mercy Mwangangi, who you later took away from me. She was in that task force. And it recommended very briefly, and many others, there was Dorcas Kemunto on the HR, human resource side. They recommended 3 key things that we have done and that we've seen improvement, and I will say them very quickly. Number 1 was to address the issue of governance in our hospitals. Our governance structure was really focused on just the medical professionals. Our hospitals level 5 and 4 are led by medical superintendents. In Nairobi, we changed that. We have CEOs who look at the 360, you know, degree of the hospital, from human resource to financing, to equipment, to facilities, to supply chain. And Your Excellency, you will attest, before I became governor, every 2-3 weeks you would hear about Mama Lucy, You hear about Pumwani, you hear about children stolen, na siku hizi husikii hizo story. Because our CEOs have transformed. Our CEOs, and many of them are here, have transformed the governance in our hospitals in level 4 and level 5. Secondly, we brought together a hybrid board. All our hospitals have boards that combine professionals and community representation. In my boards, you will find a professor and a mamafua. You will find at Gaucho. You will find a doctor and a representative of the people. Because in that setting, Namaliza, Governor, in that setting, you need somebody who connects directly to the people. In fact, there was a lady, and Dr. Gitai will tell you, one of the best members of his board at Mbagathi, which is one of the best performing hospitals in this country, is a lady named Edwina Amamafua, who I found. And he says her contribution, because she herself gave birth in that hospital, her contribution to the issues of governance is sometimes beyond some of the professionals. So that's something I would encourage for us to do across the country. Ya mwisho kabisa, Your Excellency, our community health promoters wanafanya kazi. Mine, I have 7,860 in Nairobi, covering close to 800,000 households. Na Nairobi unajua ndo ilianza kulipa stipends, ni kweli? Na inachelewanga? Hata kitingika mnanioneshanga. Na mjai nitumie M-Pesa hata siku moja. But Your Excellency, their connection to the people on the ground can help us avoid the situations that we've had where mothers have not been able to go to hospital. They have challenges sometimes with equipment. We are trying to get them gumboots and raincoats. We pray that Your Excellency, you can enhance the kind of PPE that we give these community health promoters. Kwa hiyo mengi, let me recognize Esther Passaris. Esther Passaris is the women rep of Nairobi. Please stand up. It's good to recognize you. Hawa ni watu wako. Mungu awabariki, asanteni sana.
Your Excellency, where they just sit, if they could maybe stand up so that we recognize them. These governors have come from far. You know, if I don't do this next time, they'll say we came to State House, we weren't even recognized. I'll start with my Vice Chair, Governor Muthomi Njoki. Please just stand where you are so that people can see you. Governor Dr. Wilbur Otichilo Vihiga. Governor, Her Excellency Anne Waiguru, who is here. Governor, Her Excellency Fatuma Achani of Kwale. Her Excellency Cecily Mbarire of Embu. Governor Abdul Samad Sharif, who spoke. And then we have Governor Sakaja spoke. Governor Nadif Jama of Garissa. Nadif, that looks like. Benjamin Cheboy Baringo. Patrick Olentutu of Narok. Mohammed Ali of Marsabit. And Mohammed Khalif of Mandera. We also have a number of deputy governors representing their governors. I'll just read their names. Christine Kinanga of Taita, Jennifer Batiani of Bungoma, Lucy Mulili of Makweni, Her Excellency Ruben Kamori of Laikipia, Philemon Benia of Tanzania, Martin Moshisho of Kajiado, Dr. Yulita Mitei of Nandi, Robert Achaule of West Pokot, and Kiraniri Waroe of Nyeri. Your Excellency, I'll try and keep it short. It gives me great pleasure to join you today for the launch of Every Woman and Every Newborn Everywhere, EWENE acceleration plan, together with the Maternal and Newborn Health Rapid Results Initiative. These initiatives come at a critical time for our country as we continue to confront the unacceptable burden of preventable maternal and newborn deaths. I'll not go into the statistics. The good lady from WHO captured very well. Investing in maternal and newborn health is not only a moral obligation, but a smart economic investment for a country. Every dollar invested in maternal and newborn health yields, we're told, $8.4 to $13 in social and economic returns. Your Excellency, as a Council, we're committed to supporting, as a Council of Governors, COG, we are committed to supporting counties to improve maternal and newborn outcomes through strong leadership, coordination, and accountability. And this is why Your Excellency has spoken to by my predecessor here, and Abdul Samad Sharif Nasir, Governor of Mombasa and our Chair of Health. 8 months ago, we instituted the Inter-County Maternal and Perinatal Death Surveillance and Response MPDSR initiative, a county-led peer learning, joint problem solving, and advocacy focused on ending preventable maternal and newborn deaths. This initiative created a structured mechanism for cross-county learning. And the specific interventions led by the COG include developing inter-county MPDSR website, institutionalizing inter-county MPDSR dashboards, hosting monthly national high-level MPDSR webinars, provision of on-site technical support, mentorship, and peer-to-peer learning, including convening town hall meetings, continuous resource mobilization for counties, sustained advocacy through maternal and newborn health champions engagement, and county governments continue also to strengthen community health systems through improved awareness, just giving the highlights. Despite these achievements, we have a great risk of losing mothers still, and we have a great task ahead of us to sustain the gains made and to leverage on the successes to achieve even more. Your Excellency, honorable members of Parliament are here. The question of giving health care for counties is also one of funding. A lot more can be achieved with a lot more funding, especially now that we've also noted that there's dwindling of donor resources. The policies that we propose, the regulations, laws, and policies must appreciate the need for coordination between the two levels of government, because as we saw at the dashboard there, a lot of the deliveries actually happen in county hospitals. At times, disease outbreaks continue to disrupt the ordinary provision of healthcare services and cause misdirection of critical resources. We still have some stockouts of supplies here and there, although there's a great improvement, and many times you also have infrastructural limitation. Your Excellency, I don't want to go into the issues of SHA. We will work with the CS and the CEO on the issues that the governors have, which I'm sure my colleague Abdul Sharif briefed you on, but I believe they are surmountable. Your Excellency, I just want to note for the record that as a president, you have set the right tone at the top. You have invested money. You have changed laws and policies to improve health. And the team of the CS. And I think we need to spend a lot more time together between the COG and the MOH to navigate the operational challenges so that your aim is not thwarted by operational inefficiencies on our side, Your Excellency. Your Excellency, the resilience and effectiveness of our healthcare system is ultimately reflected in the state of our maternal and newborn health indicators. And across all counties, there has been significant improvement recorded. One of the things we'll be seeking is the consideration of the inclusion of level 4 and level 5 facilities in the free maternity services program, because in spite of the referral arrangements we put in place, many mothers still go directly to the level 4 and the level 5. As I conclude, Your Excellency, the global commitment to end preventable maternal and newborn deaths can only be achieved if all counties are adequately supported and enabled to deliver high-quality services. The NEST program is changing the face of many health facilities in this country. It's increasing their capability, and the program that we launched today for the 20 counties with the highest burden will also go a long way in assisting the counties with the highest burden to deal with matters of maternal health, maternal and newborn health. As a council, we reaffirm our unwavering commitment to ensuring improved healthcare service delivery across all counties. Additionally, we call upon our partners to support the full implementation and operationalization of our investment case on maternal and perinatal death surveillance and response MPDSR platform as a critical way towards accelerating reductions in preventable maternal and newborn deaths. This launch is therefore not just another launch, Your Excellency. It's a call to action. It's a commitment to accountability. It's a renewed promise. It's a renewed promise to the women and children of Kenya. Together, let's move beyond boundaries and collectively accelerate actions towards ending preventable maternal and newborn deaths in Kenya. I conclude by reiterating your effort, Your Excellency, together with the First Lady, in ensuring the improvement of maternal and child health, newborn health in Kenya. With those many remarks, may I then invite my brother, the CS of Health, Aden Duale, to address us. Thank you.
Your Excellency, the President of the Republic of Kenya, Dr. William Ruto, Her Excellency, our First Lady, distinguished guests, ladies and gentlemen. Your Excellency, allow me to begin by expressing my sincere gratitude for honoring our invitation to personally launch the Every Woman, Every Newborn, and Everywhere National Acceleration and Rapid Result Initiative. Your presence here today, sir, sends a very powerful message that the life of every Kenyan woman and every newborn matters at the highest level of government. Your Excellency, your commitment to health, and particularly to the well-being of mothers and newborns, has been very consistent, and it has demonstrated that this is not merely a health agenda, but one of the highest priorities of your administration. Through your leadership, we have witnessed a deliberate focus without financial hardship. We are particularly encouraged, Your Excellency, because we know this initiative carries with you your energy, your commitment, and your strong engagement both nationally and internationally in advancing health priorities. We are eager to pick from the momentum generated by your leadership, your advocacy, and your ability to mobilize partnership and global support around the issue of the matter of the people of Kenya. Your Excellency, we are confident that this initiative will succeed because presidential commitments changes and brings good outcomes. When the leadership at the highest level places focus on an issue, systems align, institutions respond, resources are mobilized, and implementations are accelerated. Today, therefore, Your Excellency, marks a shift from commitment to implementation. The Iwene Initiative and the Rapid Result Initiative are designed to ensure that interventions already made have proven and have saved lives, which are delivered at our public, private, and faith health facilities. Your Excellency, most maternal and newborn deaths are preventable. The challenge before us is not lack of knowledge of what works, but ensuring that the right interventions reach every mother. The most needed. And the Ministry of Health, Your Excellency, is therefore focusing on the practical drivers of survival, skilled health workers, emergency obstetric and newborn care, functional referral systems, blood services, and interrupted availability of life-saving commodities. And we have established, Your Excellency, very ambitious but achievable targets aimed at expanding skilled deliveries, strengthening antenatal care, increasing county capacity for specialized care for both the sick and the newborn. Finally, Your Excellency, I call upon all our 47 counties who have worked with us day and night, our healthcare workers, our development partners, our professional associations and unions that are here today, our communities, to rally behind this initiative, because under your leadership, we now have both the political will and the technical pathway to ensure that no mother or newborn is left behind. Your Excellency, the country is ready for this step change. We are ready to implement your vision of a Kenya where no mother loses her life while bringing forth another. It is now my distinct honor and humble privilege to invite His Excellency the President to deliver our keynote address and officially launch this accelerated. I ask all of us to stand up.
Please, let's take our seats. Asanteni sana. Waheshimiwa viongozi wote, mashujaa wetu CHPs, public officials here led by chiefs, wamama wetu pamoja na watoto, hamjambo. An issue that goes to the very heart of our nation's dignity, the survival and the well-being of our mothers and newborns. No nation can truly call itself progressive when women continue to lose their lives while giving life. Every maternal death is a profound tragedy, especially because the overwhelming majority of these deaths are preventable. As President, I reaffirm today that no woman in Kenya should die deserves not only the right to survive, but also the opportunity
to thrive. While Kenya has made progress in expanding access to health, we must also acknowledge that maternal and newborn deaths remain unacceptably high. With only 4 years remaining before meeting our national and global targets, it can no longer be business as usual. We cannot continue losing precious lives to preventable causes. When I say unacceptably high, I mean that, and I remember an incident. I was in New York last year, and a lady, Professor Sanait of Warren Buffett, she walked to me and told me, "Mr. President, women and children are dying in your country." You know, I looked at that lady, and it was a very embarrassing moment to me. Because she went on to tell me, "You are in the league of Afghanistan." I don't know whether you people know where that is. You know? And she told me Kenya is a very progressive country, and it is shameful that mothers continue to lose lives when they are giving birth, and newborns continue to die. And it quickly reminded me of my very own personal experience. Mama Rachel here and I lost our firstborn son. So it's not something that is far-fetched. It's not something that is a story. It's a reality that we live through every day. And health, as I have always said, cannot continue to be a privilege for those who can afford, those who have jobs, or those who have money. It cannot. Health must be, as is in the Constitution, Section 43, a right for every citizen of the Republic of Kenya, irrespective of who they are, where they come from, their social, economic status, or whatever other persuasion. And it is the reason why I was willing to do anything to make sure that universal health coverage succeeds. I am very happy today. Today, I can say here with confidence, and governors are here. They are the ones who run our health institutions. Today, we have a different story. It is not what it was. Sometimes people don't want to say, because as I said earlier, good news is never news. You know? And I saw Abdul Swamad trying to persuade the media as to what kind of headline to have tomorrow. I want to tell you, Abdul Swamad, you will never get such an headline. Because it will sell no newspaper. You know? But that aside, what we are doing here today, when I came back from New York, I called Aden Duale, and I told my friend, it cannot be. These women in Kenya cannot continue to die. I'm very happy that the progress we have made in the last 6 months is clear and demonstrable. In 6 months' time, God willing, we must cut down by half the number of women and newborns, by half. And we must progressively drive it to the place where we can account for every mother and every child. We can account for every pregnancy. And I have instructed the Digital Health Authority, and the CEO is here. I receive reports every evening between 10 and 11 p.m. on the registrations of SHA and all the other things that we must now have. How many mothers and how many newborns did we lose every day? Who are their names? Who are their names? Which facility? Which health professional? Because all these are preventable. And therefore, we must hold each other to account. And I'm very happy governors are here. We did mobilize resources because apart from everything else that we are doing, there was need for resources. There is need for equipment for us to be able to capacitate the hospitals to handle these situations. And you see, when we talk about pregnancy, it's not about women. No woman gets pregnant on their own. So no, the men, we must not pretend that we are here and this is a women issue and it should be about, no. We must also be candid about us because every pregnancy a man is involved. And number two, a pregnancy doesn't happen, childbirth doesn't happen overnight. You know, this is, you have notice of 9 months. So to pretend at the very last minute that you are not organized, you didn't know, I don't know what happened, is to be, it's not correct. How we end up with an emergency on a situation we have 9 months notice is completely reckless. There is no emergency that of 9 months, honestly. So this cannot continue. And the 20 counties that have the highest burden, the names are here. The 20 counties. We have real people. We have leaders in those counties. We have women leaders in those counties. We have governors in those counties. We have members of parliament in those counties. We have chiefs and everybody. And I want to promise you that I will lead from the front. That is what I have done. Until we stop this. A maternal or newborn death does not only devastate a family, it weakens the very foundation of a community and a nation. When a mother survives, her child is more likely to be immunized, well-nourished, educated, and become productive. By protecting mothers and children, we are not merely saving lives. We are breaking cycles of poverty and building a stronger future for Kenya.
It is for this reason that today we launch the Every Woman, Every Newborn, Everywhere Acceleration Plan 2026-2028, Kenya's national roadmap to end preventable maternal and newborn deaths and strengthen the systems that protect families across our country. At the center of this plan is an immediate 6-month maternal and newborn health rapid results initiative running from now until November 2026. This will be an urgent nationwide effort to deliver measurable results and accelerate action where it matters most. We already know the greatest threats facing women and newborns: delays in seeking care. My good Leah just told us what the situation is. Delays in reaching health facilities and delays in receiving quality treatment once at these facilities. These challenges are often worsened by weak referral systems, shortages of essential medicines, and gaps in frontline health services. Today, I'm therefore declaring a whole of society response to this challenge. This is not a task for the Ministry of Health alone. It's not about the county alone. It requires all of us, the national government, the county government, parliament, religious leaders, and I'm happy Kabiru, the Bishop of Nairobi, is right here with us, the private sector, health workers, and citizens, including our civil society. I listened to my good brother there who runs an organization to sensitize matters to do with maternal health. We all need to move together urgently and with purpose. This administration has already laid the foundation for this transformation. We have allocated 13.1 billion to the Primary Health Fund and continue to support more than the 107 community health promoters who serve as the frontline guardians of mothers and newborns in our communities. And I want to congratulate these good people. I say they are our true soldiers. When we proposed that let us pay them a small stipend, I want to thank county governors. We agreed, and many of you had gone ahead. We are now working together. We will do the following because they have demonstrated impact and outcomes that justify us doing more for our CHPs. We are providing money in this year's budget, close to 2.3 billion shillings, to give them new kits. We know the kits they have used is now 3-4 years going. So we are going to provide them with new kits. Number two, we are also going to ensure that each and every CHP, in partnership with counties, we pay for them shift so that they too are covered. And number three, as Abdul Samad has said, we also make sure that their allowances don't delay. We package them into one so that they can receive it on time. We have strengthened the Social Health Authority and are leveraging digital health systems to make healthcare more transparent, more efficient, more accountable, and data-driven. To further guarantee the dignity and safety of every mother, the National Treasury will allocate an additional 4 billion Kenya shillings to SHA to cover premiums for pregnant women so that no mother is denied delivery services because of their inability to pay. No woman should ever be turned away from a health facility at the very moment when she needs care most. Further, SHA will operationalize ambulance referral services within the 6 months rapid results initiative period, supported by a clear reimbursement mechanism to ensure emergency referrals are not delayed by cost or by bureaucracy. On the issue of medical commodities, KEMSA will receive an additional allocation of 1 billion shillings. We already made 10 billion shillings available to them. They will get an additional 1 billion for the procurement of life-saving maternal and newborn health commodities, alongside Kenya shillings 2.5 billion for family planning commodities, a strategic investment capable of significantly reducing maternal deaths and improving health outcomes. Stockouts of essential maternal and newborn supplies are completely unacceptable. Every Kenyan mother deserves access to safe and reliable care, regardless of where she lives. To strengthen frontline health services, 5,000 nurses and midwives will be recruited and deployed across the country. And I am happy that members of parliament are here. Make sure that the budget we propose carries the resources for us to achieve this. A skilled health worker is, let me repeat this, a skilled health worker in the right place, at the right time, often represents the difference between life and death. Additionally, we will increase investment in safe blood systems across the country, because no woman should lose her life simply because blood was unavailable during an emergency. Ladies and gentlemen, accountability for these commitments begins with me. I will personally engage governors to ensure this initiative delivers measurable results. We will agree on clear targets, review progress regularly, and account not only for every shilling spent, but also for every pregnancy and every life saved. This initiative will be guided by real-time accountability systems, including monthly performance dashboards and digital reporting tools. Every maternal and newborn death must be reviewed, not necessarily to assign blame, but to prevent the next avoidable tragedy. I mean every. And I am happy that in the ecosystem that we are building, Mzee wa Nyumba Kumi, Chief, the whole community will be in the equation. We want a report. If a hospital fails to report the death of a mother or a child, the community should, the chief should, the Nyumba Kumi person should, the next person should, because we must account for every mother. To our governors, I ask you to lead from the front, because outcomes will ultimately be determined in our counties, hospitals, maternity wards, and health centers. To our health workers, I express the gratitude of our nation. You carry the greatest burden of this mission. and your service saves lives every single day. To our partners and the private sector, to the Susan Buffett Foundation and other partners, I urge you to continue working with us. We will deploy our own resources. We will use well whatever other resources are made available to us as we align all our support behind this single national plan. And to our communities, I appeal to you: seek care early, support pregnant mothers, and never remain silent when preventable deaths occur. The community, yes, let us not remain silent. Ladies and gentlemen, let us be the generation that refused to accept preventable maternal and newborn deaths as normal. Let us be the generation that chose action over indifference and urgency over delay. And together, let us build a Kenya where every mother survives childbirth and every child has a fair chance at life. Let me say this in conclusion, that we will do our part. The progress we have made in making sure every facility has the resources, either through PHC or through SHIP, SHA in total, have resources. I've been taking time to speak to some of our governors here, that every month we release money that goes to our facilities. Today, facilities that have never seen money, today they receive money. Magavana, ni ukweli ama si ukweli? Yes, na musemi. Munawacha tu hawa watu wananipigia makelele, SHA is not working, SHA is not working. You know? And those who are telling us SHA is not working, they have no clue what works. They have no idea. You know? Listen, friends. I am very confident about the future of this nation. We are running SHA, not on borrowed money, not on gifts. We are running SHA, the largest undertaking by any administration on matters health using our own resources. Yes. The great people of Kenya are funding it. SHA, yes, the great people of Kenya are funding SHA. And we are seeing results. KEMSA today, the refill rate 3 years ago at KEMSA was 37, 38%. The CEO of KEMSA is here. Now we are all the way to 90. And we should take it to 100. We must take it to 100. I was speaking to Cess here, and she was telling me, one of the hospitals she went, she was surprised at the store, how full the medicine was. I mean, for the first time, you know? And I told my friends, governors here, if you want us to succeed, we must solve this Hakuna Dawa problem in our health facilities. And I want to ask very respectfully that the resources that goes from SHA to facilities, the first use of that money should be to make sure that there are health commodities. There is medicine. You know? Today, there are some hospitals, they have money, they don't know what to do with it. I'm told, some governors are telling me, the hospital boards are going to ask them, so what are we supposed to do with this money? You know? Because many of the counties have implemented FIF, every facility. And I like what Sakaja was saying here. We must empower every facility. We must give it the right board. Citizens must be involved. They must be there. The local people must be there, you know, and they must understand what is going on. Because when we send money, they must be the ones to prioritize how that money is used. What comes first? Is it building the gate or is it buying medicine? The people must take that decision at that level. And we will continue building capacity. You know, I am very passionate about universal health because so many people get into poverty because of health bills, which we can pay for, you know, which we can pay if we are organized the way we are organized. Today, the WhatsApp groups for raising harambes for hospital bills have gone down. Yes. That is the reality. Today you have testimonies in villages, in small places. Shah paid this much, Shah paid that much, the other Shah paid the other much. That is, and this is just 1 year, 1.5 years. You know, I went to Egypt. And I don't know who was there with me. Yes, Duale was there with me. The Minister for Health, we were taken through their universal health coverage. And it is almost similar to ours. They started it before us. But they have, out of a population of 100 million people, 100 plus million people, they only have about 8 million people. When we tell people we have 31 million people on our platform in 1.5 years, it doesn't look real. And it will never make it to the headline. But you know, that's the kind of transformation that's going on around our country. But, headline or no headline, Kenya is transforming. And we will do it. And I am very confident about the future of this country. Yeah? So, let us get at it. It is now, ladies and gentlemen, my very distinct honor to officially launch the Every Woman, Every Newborn, Everywhere Acceleration Plan 2026-2028 and Phase 1 of its implementation, the Maternal and Newborn Health Rapid Results Initiative. Just give me a minute. We have just released equipment going to 630 facilities in 20 counties. The counties who are doing well, they've told me they should not be punished for doing well. We will make sure they too get equipment. And we will continue pushing the needle until we get every facility equipped to make sure that no mother dies and no newborn dies. Because we can do it. We have the capacity to do it. I have said we will hire more nurses. We will train more people. We will have more new midwives for us to have the human capital enough to prevent our children, our newborns, and our mothers from losing their lives. This is not politics. This is about life. This is about Kenya. And we must do it together. I want to thank the county governments They have been phenomenal. Let me say that. In the past, we used to argue. But I think we have settled the arguments in terms of who is big, who is small, whose position, whose responsibility, all that we have finished, because we've all realized that ultimately we serve one people, the people of Kenya. And counties can support national government, and national government can support counties. That's the spirit of the Constitution itself. And there is no competition between the national government and counties. We have just signed another agreement, cooperation agreement, for our county aggregation and industrial parks. We will be providing resources for the rollout of common user facilities in our county aggregation and industrial parks to support agro-processing, value addition, manufacturing in every county. Again, in partnership with county governments. And we very sincerely, I very sincerely appreciate that partnership. And you can count on my goodwill, you can count on my support and my partnership and that of the administration as we work together. Ladies and gentlemen, let me conclude this by saying I am truly, truly proud. We had a very emotional moment this morning. We've had another very emotional moment this afternoon. Today was a day of great emotion. I don't know what happened. But we are making good progress. Very, very good progress. So, asanteni sana. Tumekubaliana na hawa CHPs, tumekubaliana na wamama wetu. Tutashirikiana, tutafanya kazi pamoja na tutabadilisha Kenya tukiwa pamoja. Asanteni sana na watakia baraka ya Mungu. Thank you very much.
Thank you, Your Excellency. I seek your indulgence in the next session. Kindly, the rest of us can take our seats. Let's take our seats. At this point, I would like to invite CS Duale to present the Ewene Acceleration Plan 2026-2028. Kindly, let's have the document presented to the CS so that it can be presented to His Excellency, the President. This is the roadmap that is geared towards strengthening our health care systems. Let's give a round of applause to our President as he receives that document. Thank you. CS, kindly just remain on stage. At this point, Your Excellency, you will be awarding the best healthcare facility. And this award goes to Pumwani Maternity Hospital, which is Kenya's busiest maternity facility. It manages over 11,500 deliveries annually. It also records 17.3 maternal deaths per 100,000 deliveries, significantly below the national average of 92 per 100,000. Makofi tafadhali to Maternity Hospital, Pumwani Maternity Hospital. You can kindly Thank you, Your Excellency. Thank you. We can now proceed back to our seats. Thank you, Your Excellency. We can now proceed back to our seats. At this point, I would like to invite the First Lady, Mama Rachel, kindly to come to the stage. She will be presenting gift hampers to the mamas that we see here today. And the first mama to receive a gift from Her Excellency is Kushu Fatuma, followed by Mercy Otieno, Maritha Wanjiko, tuwape makofi mazuri wanapopata zawadi kutoka kwa Mama Taifa. Njoni upande huu kisha pokea zawadi yako, njoo upande huu. Aha, asante. Mercy Otieno anapokea zawadi yake. Maritha Wanjiko. Makofi tena. Faith Kituku. Akifuatwa na Roslyn Ochieng. Margaret Kibathu. Margaret Kibathu, njoo. Joyce Semoi, njoo mbele. Lavena Achieng atafuata. Hawa Matunda, kila mama na mtoto wake wakipokea mmoja baada ya mwingine zawadi kutoka kwa Mama Taifa, bila shaka zawadi zitakazo wafaidi wao na watoto wao. Tuendelee kupokea zawadi hizo. Selina Atieno akifuata Patricia Lena, mkae tayari. Juanita Aluse, tuendelee kufika jukwani tafadhali. Anastasia Mutuko akifuatwa na Brenda Nafuna. Phyllis Wangoi wawe tayari kwenye foleni. Lillian Beth, Kanini Sila na Yvonne Muyula samahani. Tuendelee kufika jukwani. Kina mama wa Kenya pamoja na watoto wao. Zawadi wanazozipokea ni tuzo kutoka kwa Mama Taifa kuhakikisha kwamba watoto hivi leo watakuwa wako sawa kabisa. Na baada ya mwisho kukabidhiwa, kina mama hawa watarejea jukwani kwa ajili ya picha. Na nitamwomba Mheshimiwa Rais tafadhali urejee jukwani ujumuike na Mama Taifa kwa ajili ya picha moja na kina mama hawa. Tafadhali, let's go back to the stage for a photo moment. Thank you. Naomba tafadhali wengine tuketi. Let's take our seats kindly. Thank you. We'll just have His Excellency, our First Lady, and our mothers. Naomba tupate picha hiyo moja, tuangalie kule mbele kwa wapiga picha wetu. Asanteni, naomba tafadhali kina mama tuondoke, kina mama tuondoke. Mheshimiwa Rais pamoja na Mama Taifa, naomba tafadhali msalie jukwani. Bwana CS, PS, our governors and deputy governors. Subiri kidogo, subiri kidogo.
Your Excellency, because of time, I think Kirinyaga County and Nyandarua County were also the two counties that we were to give an award. So I will ask Her Excellency Anne Waiguru and her team to come here and take a photo as I deliver the award maybe next week when I'm in Kirinyaga. Nyandarua County, I'm not seeing the governor, but this Kirinyaga team is here.
Nyandarua County and Kirinyaga County were the best performing counties in healthcare services. Let's give them a round of applause kindly as they take a photo with His Excellency and the First Lady. I'll kindly request Your Excellency you remain on stage. Bwana CS, governors and our deputy governors and our development partners join His Excellency for the last photo. Tafadhali njooni mbele. WHO, UNICEF, World Bank, Gates Foundation, the representatives just come to the front, and STBF. This is the last photo. This is our very last photo this evening.